Welcome back to Medical Monday. It's the #1 reason for heart disease, blindness, amputations, renal failure, and nerve pain. Millions of people with diabetes take medications to try and deal with the symptoms, but our next guest says their treatment is designed to handle the root cause. The symptoms go away. In many cases, the damage caused by diabetes can actually be reversed. No more pain, improved eyesight, no more need for dialysis. Here to explain how the revolutionary treatment works, we have Dr. Stanley Lewis back with us with diabetes relief and his patient, Ulysses Larisma. Good morning.
Good morning.
Thanks for joining us. Okay, let me just say, normally you would be here with glasses on.
That's correct.
But you didn't take them off just because you were going to be on TV.
No.
You don't need them anymore.
No, I don't need them anymore. Ever since I had the treatment 2 months ago, my eyesight has progressively gone better.
Wow. Okay, so that's just an example of what can go better, and so many other symptoms that come along with diabetes can go better. Tell us how this works, and it's for anyone who's type 2 or type 1, right?
Correct. So anyone who's got a metabolic disorder that ultimately results in them losing their pancreatic pulse. And what I mean by the pancreatic pulse is your pancreas is, it produces insulin in a pulsatile fashion. This fashion is very important with the ultimate metabolism of glucose in the body. Without this pulse, you don't get the nutrition to your cells as you would normally get, and thus you ultimately get the complications of diabetes.
Yeah. We're looking at this graphic right here.
Right, so the red line shows where the normal glucose pulse released by the beta cells in the pancreas. You also see a green line that represents the glucagon, which is released by the alpha cells in the pancreas. This rhythm is the natural physiologic rhythm of life.
And when that rhythm is disrupted, you have like low energy, foot issues, poor eyesight, uncontrollable blood sugar, all that type of stuff. Okay, so what is it that you're doing? What's the treatment look like? What is it?
Well, the treatment, first you'll come in, have an evaluation by our medical staff, and we'll determine exactly how sensitive you are to insulin. And then from there, we can design a regimen that's individualized for your care.
Yeah, and that is a transfusion or not, or is it infusion?
It will involve an infusion, and this infusion usually lasts anywhere from 2 to 3 hours, once or twice a month.
Yeah, all right. So Ulysses, you kind of had given up because you were taking medications, right?
Yes, for 10 years, Deborah, I've been taking the medication, and it seems like I progressively went on from one medication to another medication, and I felt pretty much I was always lethargic.
Yeah.
And
so you weren't getting any better, even though we kept adding medications to it.
That's true.
Yeah. So when people say, "But I'm taking the medication, doctor," so what's going on?
Right, and you see the numbers look good, right?
Yeah.
So the physician may feel very, very comfortable with the fact that the hemoglobin A1C, which is the main measure, surrogate measure of control of your diabetes, it may be well within the normal range. But if you listen to your patients, you'll hear a different story.
Yeah.
You hear the
how
story
you feel is the truth of what's happening.
of how they really feel.
Yeah.
So that for me was very motivating to get involved with diabetes relief and to really start looking at the root cause of what was really going on with metabolic disorders.
Yeah, because it's interesting. I kind of, my analogy is that you have a smoke alarm in your house, but the batteries are out, and you're saying, no, my house is not on fire because the smoke alarm's not going off. And so sometimes medications can make you feel like, you know, give you the right numbers, make you feel okay. But
True.
As we said, you were taking more medications, and you're slowly going downhill. It's almost like a slow death,
That is correct. I have energy, and then all of a sudden it'll flat out. And I didn't like that feeling. When I come across this new treatment, that first day that I was treated,
at first.
I was very skeptical, really very skeptical. And the first day, something wonderful happened.
What was that?
I had a lot of energy, enough for me to do a lot of chores for the whole day. As a matter of fact, I did the chores way
Your wife
after
was happy
it.
with you, wasn't she?
Absolutely.
Yeah.
She was.
Yeah. So you knew something was changing physically inside of you. All right, and then you start seeing your eyesight get better. What other things improved for you?
A lot of energy to do the things that I never used to do before.
Yeah. All right, so Dr. Lewis, when people come in, how often do they have this treatment? Is this treatment for the rest of their life? Is it what?
Well, diabetes is a lifelong disease, and this is not a cure. But for a lot of patients, we're able to get them off of some of their medications, if not all of their medications. We're able to improve the symptoms, as Ulysses here has described.
You've had people that were scheduled for amputations because, as we know, healing is a hard thing for people with diabetes who didn't have to get amputations.
Absolutely. tissue growth and tissue repair is a real problem for patients with diabetes. And if they have an injury, you know, even the #1 cause of amputations is toenail clipping in patients who have diabetes. So any injury can be a really big problem for someone who has diabetes because they don't heal well.
Simple cut, whatever. And
simple cuts.
After 12 years of being diabetic, you're kind of like going the opposite direction. And that's, I think, the thing that's so, people are so excited about is that some of the damage that has been done, neuropathy, all those types of things, people start to reverse and get their life back.
Right, it's really wonderful. And I feel for a lot of patients who come to our center who have a very similar story to Ulysses. It's not unusual to hear this story, and we're really excited to bring this therapy to patients.
Yeah, and it's growing. It's like traveling around the world, actually. People are catching on to this. All right, there's a metabolism enhancer that people are going to get. Tell us what that metabolism enhancer does.
Yes, our MeTab 360 is a metabolism enhancer. There's nothing particularly unique about it, although the formulation is proprietary. You might buy 4 or 5 other supplements and get what's in this.
Okay.
But we've uniquely formulated it so that it works with our treatment to help us extend the period of time between treatments from, say, one week every 2 weeks to maybe 3 or 4 weeks.
All right. Well, Diabetes Relief has a special offer for Great Day viewers. When you schedule a consult in February, you'll receive a free bottle of their proprietary metabolism enhancer. It's designed, as he said, to extend the beneficial effects of the treatment. You must mention Great Day Houston. I think that's what makes it a great day, when you can actually deal with diabetes and still live your life, right? You must mention Great Day Houston to receive this offer. For more information, log on to diabetesrelief.com or give them a call at this number. It's 281-600-5000. 281-600-5000. Thank you very much.
Thank you, Deborah.